Well, thank you everyone for joining us today for the first of our COVID-19 virtual town hall series. I'm Heather Bagnall, your delegate in District 33. I first wanted to thank you all for your continued commitment to staying safe by staying home and providing us the time to build out the systems required to combat this virus. As a member of the Health and Government Operations Committee, I wanted to focus this first town hall on health concerns in the time of COVID-19. I know there's been a lot of good, there's been a good deal of information in the media, some good, some not as helpful. So it can be challenging to determine the most current guidelines and also the most useful information and what's relevant to your community. I also know it can be confusing even to know where to go for the most accurate information. So I wanted to bring together our leadership at the local, state, and federal level because we're all currently working together. I'm honored to be joined today by our esteemed panel, Senator Chris Van Hollen, who's actually walking back from a vote right now, the director of the Arundel Department of Aging and Disabilities, Pamela Jordan, who'll be joining us in just a few moments, and the Arundel County Health Officer, Dr. Nilesh Kalyanaraman. As you can imagine, our panelists are very tightly scheduled, so we will attempt to answer all questions, but if we can't get to your on the call, we will circle back with you to make sure you have the answers. If you have a question and you have not submitted it in advance, please feel free to put your question in the chat if you are on the Zoom call or in the Facebook comments if you are watching this on the live stream. I also wanted to thank my team, Max Pierce, Jenna Bachman, and Luke Tudball, who are working hard behind the scenes to make me look a lot more tech savvy than I actually am. With that, I want to take a look and see if our senator has it over.
I am here.
Yes,
can you hear me?
Indeed. Well, let me welcome Senator Chris Van Hollen, who has been doing yeoman's work for us, not just at the state, but for our entire country. I won't go into your bio because I think that could occupy a good portion of this call. So with that, I would be happy to turn this over to you to talk about, give us an overview on the latest federal initiatives.
Well, thank you, Delegate Bagnall. Thank you for your leadership and for bringing us together on this call. Sorry, I was a little bit late. We just actually had a vote in the United States Senate. Everyone's trying to stagger their votes in a way that observes the right social distancing. But let me first thank you for the efforts you undertook in the Maryland General Assembly. I know that you had to cut the session short, but I think what you were able to get done during that period of time was very important to the state, including some actions that you were able to take in anticipation of what we're experiencing now from the state perspective. So what I want to do is just briefly talk about the federal efforts. And they've been aimed really in two parts. One is, of course, on the healthcare front to try to defeat the coronavirus and treat individuals who have the disease, but then also the piece that deals with the economic fallout, because so many people are experiencing economic and financial pain because of the closed businesses in order to observe social distancing. So on the healthcare front, we passed 4 pieces of legislation in relatively short order on a bipartisan basis, emergency responses. The biggest piece was called the CARES Act. And if you take all those collectively, we, number one, directed a lot more resources to our healthcare workers on the front lines, the nurses, the doctors, hospitals, but also community health centers, also nursing homes, senior living facilities. All these monies are being surged to the front lines, some more quickly than others, and we continue to push very hard to make sure, for example, that the federal funds for nursing homes and senior living facilities move faster, given the fact that you have such a concentration of cases there. Now, we've also been working hard to try to push the administration to make much better use of the Defense Production Act to increase supplies of personal protective equipment and testing. The shortages here are not a lack of dollars. It's a lack of actual supply in the United States and around the world. So all the states are competing when in fact the clear answer is the United States needs to produce a lot more in terms of personal protective equipment like masks and gowns, but also when it comes to testing, sometimes people overlook the fact that in order to really expand testing and do it in much shorter order with faster turnaround times, you need all the elements of a test. It's not just the lab component. It's the swab to take the specimen. It's the transport kit to get the specimen to the lab. Once at the lab, you need the reagents. And unless you've got all of these items in pretty much equal numbers, you don't have a successful rapid testing regime. And so you can have a whole lot of one thing, but if you don't have the swabs, you don't have a testing regime that can meet the requirements. So we are pushing hard for the administration to surge more. In fact, I'm organizing a bipartisan letter asking the president to make better use of a provision in the Defense Production Act. Now, the economic fallout has been harsh. We've seen that in Maryland. We've seen it around the country. The major elements of the economic safety net have been, number one, the unemployment compensation piece. This is really the most important broad-based worker protection because it does two important things. Number one, it increases the weekly unemployment insurance benefit by $600 a week. The second thing it did was to make many more people eligible for unemployment insurance on top of those who are traditionally eligible. So for example, part-time workers, the self-employed, gig workers, independent contractors, they're all now eligible. Now, all that being said, I think all of us recognize we are experiencing incredible backups because of the Maryland computer system, which crashed, back on Friday and has really been just, not performing nearly up to par, and that has created intense lines and cash flow shortages for people. The only silver lining here is that once someone does get through that system, it gets processed, they will receive that unemployment benefit, including the $600 additional per week, backdated to the time they were originally eligible. But we are pushing the Maryland Labor Department to pull out all the stops to really make that run more smoothly. Then there are the programs aimed at small businesses and nonprofits. You've heard a lot about those. The PPP program, Paycheck Protection Program. Again, they benefited a lot of small businesses and nonprofits, but also a lot of trouble getting the programs up and running. At least on the first round, you saw some of the bigger banks imposing conditions that were not in the law for applicants of the loans. For example, saying you had to have a pre-existing lending relationship with the bank. That's not in the law. In round two, Senator Cardin and I went to the floor of the Senate. We said, if we're going to do more money, which we needed to do because the program was running out of money, we also need to reform it so that more of the money flows through community lenders. So more money gets to mom and pop small businesses and smaller nonprofit operations. That has certainly improved it, but it has still many issues, and I'm putting forward proposals to modify and redesign part of it to make it much more user-friendly for small businesses. You all probably know about the individual payments. I'm not going to go into detail there. Finally, there was substantial support for, let me put it this way, a down payment in support for states, counties, and counties. So the state of Maryland, for example, gets $2.3 billion from that fund. And Arundel County, because it has over 500,000 people, is one of the 5 counties in Maryland that will directly draw on the federal support to the tune of about $100 million. Now, there's a catch there, which is the funds are not as flexible and usable as they should be. They can be used to pay for additional costs that the county incurs because of the coronavirus, but not because of revenues that are not to backfill lost revenues, which of course is where counties and jurisdictions really need a lot of help. And so we're pushing not only to increase the funds for state and local governments in the next round, but make it much more flexible. There is more money for schools and a number of other major agencies that help folks in need, especially on the food front. But all of these are going to need another round. I'm happy to try and answer any of your questions. Thank all of you for what you're doing to help us bend the curve in Maryland. We remain a hot spot, but we're also hopeful that we will soon be on the downward side of this and be able to find a way to safely reopen. So thank you again to the delegate, and I'm happy to try and answer any questions.
Thank you, Senator. Just took a moment to unmute. I do have a couple of questions for you. Some you may not be able to answer because I think it's the relationship between the federal and the state. But if we can't get an answer, we'll circle back to the folks asking these questions. One is self-employed are eligible, but are you aware of how the amounts are calculated? Is it a different calculation per state? And Karen, I believe I'm going to circle back with you about when you'll receive the benefits, because that's a concern that it's an ongoing conversation right now with our unemployment office.
So thanks for that question. The answer is that there's the base amount that an employee receives for unemployment insurance. And that is determined by the state formulas for people who are already part of the traditional system. And then whatever amount that is that you would normally get, there's an additional $600 from the federal government on top of that. So the answer to your question is there is some difference among the states as to how much someone will receive through the unemployment compensation system, because different states have different base amounts. But everybody who's unemployed in all of those states gets the additional $600 from the federal government. Now that additional $600 is through July 31st. And, one of the debates going forward, and depending on, how long we're in this kind of situation, is whether or not that will be extended.
Thank you. And Karen, just to clarify, because I know that we're having our own significant challenges with the unemployment in Maryland. The benefits do start from the date that you are unemployed, not from the date that you're able to file. There was a question about there was a 15-minute on-site test system in Abbott, which was in use to test inmates at the FCI in Dunbury, Connecticut. Can such equipment be used for the general populace?
This is the Abbott system that's quickly turned around. Well, the short answer is yes, it can be used, and we want to make it much more universally available. Again, it's just in short supply right now because this was an innovation that was, developed, since the pandemic hit. It hasn't been around that long. And so ramping up production of that is the key. So we need to push forward on the Abbott testing system. It does have that benefit that was just mentioned of rapid turnaround, as we also just ramp up testing across the board. But we should, clearly the sooner you can get the results, the better for the person getting the test, but also the better for everybody else, because you can make decisions more quickly, especially as we work to reopen. This testing, not just of people who exhibit symptoms, but people who are going to be coming into the workplace, or maybe especially in vulnerable communities. We really need what they call surveillance testing capacity, and that's going to require ramping up much more than we are today.
Okay, and in the next stimulus, this is a question from Eric. In the next stimulus, support nonprofit relief for large organizations. Oh, will there be support for nonprofit relief for larger organizations with staff of more than 500 employees? In Maryland, under the current programs, organizations like the American Cancer Society, the Alzheimer's Association, Catholic Charities are all left out of the federal relief package.
Yes, this is something we're looking at right now, and the This is an issue that also provides limitations on the small business fund, with some exceptions for people in the restaurant industry. As you say, if you have a national employee base and you're over $500, you don't currently qualify for the PPP program. So that is definitely something that we are taking a look at. There are other benefits that provide some relief to those larger nonprofits. For example, suspending for the time being payroll contributions for your employees. But we are looking in the next round to see whether we make the PPP type program available to nonprofits with over 500 employees.
Thank you. And before I let you go, because I know that you have to get back, but I had a question for you from the perspective of a state legislator. Is there anything we can be doing at the state level, at the local level, to push for greater testing, to push for these rapid tests and the expansion of the PPE to address these national and also local disparities?
Well, the challenge, as I said, is it's a national supply problem. We just need to make more of all of these items. And so, to the extent that a state has the capacity to encourage local employers to make more of these items, then they can do it as a state. Obviously, this is also a national function in my view, which is why we've been pushing the Trump administration to really maximize use of the DPA. They have not done that. Certainly, they've not done it for testing. But to the extent you can encourage local companies to go into helping here, Under Armour, for example, has been working and making masks. Other sort of distilleries have been working to make the hand sanitizers. We've all seen these local efforts going on, and the more we can encourage them to increase the supply, the better.
Thank you very much, Senator. I really appreciate you being on this call, and I want to thank you and your team for all the work that you're doing. You've been incredibly responsive to our requests, and I know that you've been running down to the Senate floor to keep us moving forward. So thank you.
Well, let me thank you, Delegate Bagnall, for your leadership, and I know Scott Travers with my team is on the call and will remain on the call. So both, again, it's been great working with you, but also we invite others on the call. If you need help accessing the federal programs or any other questions, let us know. Thank you very much.
Thank you. I'm not seeing, do we have Pam Jordan on the call yet?
Not as yet.
Okay, not as yet. So then I'm going to go ahead and introduce our health officer for Anne Arundel County, Dr. Nilesh Kalyanaraman, Kalyanaraman. And we've been talking quite extensively about not just the programs in Anne Arundel County, but obviously the nursing homes has been very much in the news and the media, and the challenges that we've had with the universal testing, with identifying and adapting for those congregate communities. But also Anne Arundel County has been sort of on the front of a contact tracing program that's appears to be going to be modeled statewide and possibly nationally. So if you would speak to where we are in the county.
Sure. So thank you for having me on, Delegate Bagnall. When we look at what the core activities are that we need to do to contain this virus, it's education, testing, contact tracing, and isolation and quarantine. Those are really the cornerstones of our public health approach. There are, of course, other pieces, vaccine development and treatment. Those don't exist yet. And also making sure that we are approaching this from a health equity perspective, making sure that everybody gets the gets the prevention that they need, including vulnerable populations and communities of color, which are being disproportionately impacted. So you mentioned a few items. So one, when we look at the testing is always a key. I know that Senator Van Hollen spoke about that a little bit. Where we continue to aggressively push to make sure that people get tested. We were the one of the first 2 counties to stand up with the Maryland Department of Health drive-through testing, and that's at the Glen Burnie Veep site. The health department, we're doing our own drive-through testing on Tuesdays and Thursdays, and that's really targeted to make sure that anybody without care or who is uninsured can get testing at no cost, because we know that's really an important piece to make sure everybody has access. And then we went further and are doing pop-up testing on Mondays, which are walk-up, and we're moving those around the county to different locations. This past Monday, we were in Annapolis, Glen Burnie, and Brooklyn Park. Next week, we're going to be in Maryland City and another location that I'm not sure we've settled on yet, but our goal is really to move around. And then once we do that testing, if somebody's positive, we do the contact tracing. And I think that's a really important piece for folks to understand what that is and what that looks like. Contact tracing is where we, as a health department, if somebody is positive, we'll reach out to them. We will talk to that person and try to understand where they might have been exposed to it. And more importantly, understand who was in close contact with them, to whom they might have exposed who might be exposed to the virus because of them. And that's really the key part, because then what we do is we talk to those contacts. That's why it's called contact tracing. Talk to them, see if they have any symptoms, and then ask them to go into quarantine. Quarantine is when somebody stays away from others and they don't have the symptoms. And we do that because we know it takes time, anywhere from 2 to 14 days to develop symptoms if you're going to develop symptoms. And so by keeping those people away from others, if they develop symptoms, they're not transmitting it to others. And that's the way that we're really able to slow the spread of this virus. So having the people who are confirmed to be in isolation and those who are exposed in quarantine. And then what we do, we make sure that obviously every single person is getting contact traced. But the other part of it is we make sure we're doing case management. So when we call somebody, we ask them, if when you go into isolation or quarantine, do you need anything to be able to stay in that? Do you need access to food? Do you need transportation to medical visits? Do you need housing? For folks who live in an apartment and they can't get away from anybody else, we can offer a hotel stay, because if we don't do these things, it's not going to be successful. And so the key part of what we're doing, in addition to tracing everyone, is that case management piece. And so if you do get that kind of call from us, please pick up the phone. It's really important. It's how you can help stop the spread of the virus. And so that's kind of the short overview of our process. Now, I mentioned some vulnerable populations. We look at those who are living in nursing homes, and there's been a lot of attention to that. Folks who live in a nursing home, they're older and they have chronic diseases. Both of them are high risk groups. So nursing homes are unfortunately positioned to be at the top of our at-risk populations. And we've certainly seen that. We've had a lot of outbreaks in nursing homes, not just in this county, but throughout the state and frankly throughout the country. And we've been working, I was going through my papers this week. Since March 21st, we've been working with nursing homes, assisted living facilities, homeless shelters, providing education, providing support to do social distancing, providing PPE, and doing testing for anybody who's symptomatic. And what changed last week is extending that to testing to anybody who is asymptomatic, so without symptoms as well, to try to catch anybody who has COVID but isn't showing any symptoms and maybe spreading it unwittingly. So right now we're working with all of the nursing homes to get in place their plan to do testing for all the asymptomatic patients, and many of them have already gotten that process underway and are doing that right now. We're seeing those results come in. And also to make sure that they have the staffing in place, so when they do the testing for their staff, they have additional staff they can plug in. The last thing we want to do is have our nursing homes understaffed. That's not going to serve anybody at this point. So it's a two-step process right now And we've been doing that in concert with the nursing homes and with the State Department of Health. So that's, I don't want to, I can go on for another half an hour. I'm not going to do that. I'm sure that people got questions, so I will leave it at that.
Yeah, we've got a few questions that are coming in. One of the questions that I had actually was again the relationship of the county and the state in terms of acquiring PPE, because at the state level we're getting reports from a lot of our union workers, particularly in the correctional facilities, that they are not getting adequate PPE. I know that I've reached out to a number of the nursing homes in our district who said that they were acquiring it, but there was a lot of confusing information and sort of conflicting information as to what that process was. So, what is the relationship between the county and the state in terms of ensuring that our hospitals, our nursing homes, our correctional facilities, that these facilities have access to PPE and are able to be compliant with the governor's executive orders? Yeah,
so that's a good question. So what we are doing is it's at all levels really. The nursing homes do need to try to get their PPE just as much as everybody else. That and we as a county have been trying to purchase PPE and distribute them, not just to nursing homes, but to a wide range of healthcare providers or first responders. And then the state has shipments of PPE that sends out to counties, either from the federal government or that's purchased by the state. And what we do is we distribute that to nursing homes, to primary care, to hospitals, behavioral health. And so the real challenge we have is with the amounts we get, by the time we distribute it to each of the facilities, they're each getting a small amount. And that's related once again to the national shortage. I think one of the biggest challenges we have is that we are fighting, unfortunately, other counties and states to buy this PPE. We're seeing a lot of our county included trying to buy from international sources in ways that we haven't really before. And so we're seeing increased PPE available and also conservation measures. So how do you have reusable PPE that you can sterilize and use again and again? So all of these systems are coming online. The problem is that it just wasn't ready when the outbreak hit us and everywhere throughout the state.
We had a question about the contact tracing, because Arundel County is actually hiring contact tracers. Am I correct? And what's the process for that? Who do they get in contact with, and how do they apply?
Yeah, we're going to be hiring. We haven't quite put the word out yet. We're finalizing some of the language and just our ability to hire. So what we're really looking for is two types of folks. One, we are looking for some nurses, particularly around the case management piece. And then the second is we're looking for people particularly customer service oriented. A lot of it, and preferably with some health background, but it's not necessary. A lot of this is talking to people, listening to them, understanding what their needs are, and then being able to convey the information we need to convey. So that type of ability to interact one-on-one is key. And then we do the training around the technical pieces of contact tracing, sorry. So that's really what we're looking for, and we'll certainly be sharing that information with others as soon as we're ready to go live with that.
Okay. I had a question from Matt, who returning from Maryland. He's non-symptomatic, but he had a 2-week deployment to a federal prison with positive staff and inmates, and he's planning to quarantine, but he wants to know, how can he get a test? Where can he get a test? Are we testing asymptomatic people who have had a potential exposure?
Yeah. So right now we could, we don't really have the ability to test a lot of asymptomatic people, just to be really honest about that. As a health department, we are focused on individuals who are vulnerable and symptomatic or asymptomatic in those congregate facilities like we were talking about. If you have a primary care doctor who you can get testing from, please do that. No, this is not to suggest that you shouldn't get tested, just where we're targeting our resources. And as we grow frankly, our testing capacity, that's something that we want to add on, contacts in areas where you've been exposed. If you're able to quarantine though, that's obviously the best. And so I'm happy to figure out individual details, and I know that our staff who answer our phone lines are happy to do that as well if there's any mitigating circumstances there.
Okay, we'll get you connected. And I
Great.
just got a text from my staff too that reminded us that the COVID-19 health line is 410-222-7256. They are open Monday through Thursday, 7:30 a.m. to 9 p.m. or Fridays, 7:30 a.m. to 7 p.m. And we'll put that number up in the comments as well.
And Saturdays and Sundays we're open as well from 10 to 4.
Oh,
so,
thank
yes.
you.
Mm-hmm.
I had a question from regarding the test obtained by South Korea.
Mm-hmm.
What is the status of those tests? How will other states across the nation beginning to open? How will that affect Maryland? We have a 3-step phase in, but we don't seem to have cooperation from adjacent states. So I guess the question is, you know, how do we maintain our phase in when our sister states are not? And do you recommend and offer support for isolation of contacts without testing them?
So 3 questions. Let me start with the first one. The test that came from South Korea, I think that's a good example of the difficulty anybody's having getting tests. The fact that we as a state had to go to South Korea to get the tests tells you what the market looks like right now. Senator Van Hollen was mentioning that there's a lot of pieces that have to come together. Those are the test kits that sit in a lab. They still need the reagents and the swabs. And so once the Maryland Department of Health has that together, and then those tests will really be available to be used at scale. So we haven't heard word of that yet, and we're waiting to hear word. So that's the first one. In terms of sister states and coordinating, that's going to be challenging, to be quite honest. That's something that we certainly are concerned about. We're waiting to hear from the governor about what his conversations are with other regional partners on this issue. I think a big key to this is our testing capacity and our social distancing and infection control capacity, just as much as we talk about testing. A lot of the steps that we've taken now are going to have to continue into the future. Things like masks, hand washing, hand hygiene, 6 feet apart. Those aren't going away. Those are going to have to be in place so that as we open back up, we can do it safely. And then the last piece, forgive me, I don't remember the last part of it. But.
That's okay. Do you recommend or offer support for isolation of contacts without testing them?
So we don't really have a great way to do that, but what we can do is test individuals to figure out what their status is, because we don't have the ability to provide those supports without a positive test or without a quarantine order from us.
Okay. If you wouldn't mind, one of the big concerns, even from the very beginning of this crisis, was the mental health act of not just of isolation, but of the financial impact, the fear factor of exposure, and what resources we have within the county. Particularly because so much of what we're having to do is online, and not everyone has access to the internet. So what are the available resources, and you know, how can we connect those populations with the resources available?
Yeah, no, I'm glad you brought that up. One of the things that is really critical is to understand the mental impacts of this pandemic. We know that there's a lot of anxiety, there's a lot of fear, there's a lot of uncertainty, and I think that's probably the biggest hallmark of this. In terms of resources that are available, one thing that is always available is the mental health hotline and warm line. And the difference is essentially hotline is for emergencies, and you can think of the warm line as the 311 equivalent. You can call that to get information, to just talk. there's always somebody who's able to answer that phone. And so we strongly recommend you use that. You don't need to be online for any of that. At the same time, the Mental Health Agency does have resources available on its website, as does the Arundel County Department of Health. And I'd really encourage you to take a look at a live feed we had last week. Myself, the county executive, and Dr. George Everly, who has worked in different parts of the world on pandemics and crises, and how you can attend to your mental health as part of a response to this. And it was really, I think there's really two key items that I took from that. One is to be kind to yourself and to be kind to others. This is a tough time, and I'm certainly guilty of this. Try to apply the standards of yesterday to today, and today is just very different than what things looked like a few months ago. And the other is to try to focus on what you can control. All of us are losing control over our worlds in the way that they used to be. And that's hard. That's hard. None of us likes to lose control. And so focusing on the things you can control and the things that, and putting your energies there is a way to try to at least focus your energies in more constructive ways. There are obviously other ways to do it, but those are two of the things that I really took from that.
Thank you. Where would you recommend to go? This is a question from Paul. Where would you recommend to go to be tested to determine if you have been exposed, if you may be asymptomatic but have the antibodies for the virus? Because I know that that we're looking for those populations that may already have some inherent immunity.
Yep. So right now there's scattered pockets of antibody testing. I'm not really sure, to be quite honest. I know that some primary care offices are starting to send that test out. So I would encourage you to get in touch with your doctor to ask that question. We at the health department aren't doing antibody testing yet. That's because mainly we're trying to focus on people who have active disease so that we can stop the spread. And the other is that the antibody testing, just really, there isn't a lot of it at this time. There's a lot more talk about it than availability of it. So as much as we're fighting for those swabs, we would have to fight 100 times as hard to get antibody testing. It's just not where we're putting our energy at this moment. But we will eventually.
Paul, I'll also reach out to my contact at the state health department, because it might be possible that even if we're not actively doing it, that we could cull together a resource list to make it easier for people to identify where they could actually go for those antibody tests. So I'll circle back on that one. We've got lots of questions coming in. This question's from Laura. I work at a public library. How will the public bathrooms be handled? Social distancing wouldn't be possible, and hot air hair dryers blow stale air around. Cleaning the bathrooms after each use would be impossible, but can county buildings be open without bathrooms available? And I know this is a huge concern because, again, the libraries are one of our only resources for our homeless population, for populations that don't have access to Wi-Fi. We're already experiencing this as an issue with the census, with the elections, with all of the online education programs. So I know that there is a desire to get those libraries open.
Mm-hmm. Yeah, so we've been talking with such services around exactly this issue with the bathrooms, but also with buildings in general, and how we make sure that we are cleaning them properly. And they've been doing that. I mean, we talked about this right at the beginning, what products they need to use, how frequently they need to use it. And I think that part of, a good point that you make is part of that is putting up instructions in bathrooms around how you can make sure, because you're right, you can't clean it after every use. That's not feasible. So how do you make sure that you are using not just the bathroom, but honestly any public space safely? That applies to, if you're in the library and you're taking out books or using a computer. So we'll be making sure that that kind of guidance or instructions are posted.
Thank you. This is actually a comment from Mickey. Anne Arundel Medical Center has set up a curbside acceptance station open on Wednesday and Friday from 10 a.m. to 12 p.m. For donation of PPE. including homemade masks, surgical gowns, and hats at the Belcher Pavilion 2000 Medical Parkway in Annapolis. Thank you for that. That's good information to share. Let's see, does Dr. This is a question from Eric. As the governor's executive orders will eventually expire, what's the path forward for sustaining a high quality of care in Anne Arundel County nursing homes?
So the governor's orders, while they may expire, will still be in contact. The state will still be in contact with them, and we can still put guidelines out, and we still will put guidelines out around what the ongoing standards of care are. I believe that the order is really more about getting it done this minute, but that type of guidance and changes come out frequently. We've been putting out guidance and supports, and certainly our nursing homes generally want to comply and want to do what's best. And so I don't see any decrease in intensity of effort with our nursing homes in the long term.
Now, we actually talked yesterday about the staffing issue and the fact that the nursing homes are primarily using the same resource for staffing. If we have folks that are on this call that are, you know, in the medical profession, but maybe would be willing to step up and volunteer and train for substituting in those positions, is there a resource? Is there someone they should contact?
Yeah, the best way to do that is, so what we were talking about yesterday is that with the nursing homes, they certainly have their staffing, but they also use typically some agencies for if they need to backfill positions, or there's somebody calls out and they need somebody on the moment. But in this situation, everybody is tapping the same resources, and it's not working the same way as it used to. So if you have a medical background and you're interested, I would encourage you to go to Maryland Responds. It's the state's volunteer site, and they're collecting names. And what we're doing is that both for the hospitals and nursing homes, that's a source to draw on for folks who are going to be able to slot in for any of those situations as appropriate.
Thank you. And I'm just double checking with my team, and it appears that Pamela Jordan has not been able to stay on the call or get on this call. So if you're amenable, Dr. K, I'd love to keep asking you questions.
Sure.
But I just wanted to be conscientious of your time. This is a challenging one to answer, but I want to ask it anyway. Because it is a question that came in, and people are trying to figure out what the process is. If we have an idea of how long we will be wearing masks, and if someone sees, is in a business that is not being compliant, do they report it? Do they, who do they report to? Obviously, we don't, be in the habit of just contacting the police for non-emergency, non-compliance. We don't want that to become our culture. So, what do we do?
So to the first part of that, masks are going to be here for a while. From what we've learned about that people without symptoms who have COVID can transmit it, the masks are really to prevent you from giving it to someone else. That's really what they're most effective at, particularly when you don't know you might have it. And that's going to be a key part of how we bring services back online. When you do see businesses that are not handling infection control masks appropriately, you can call the health department. That number that Delegate Bagnall gave earlier is the number you can call, 410-222-7256. And we have folks who go out and provide education and guidance and support to the businesses. As we talked about when this first came out, our goal is not to close businesses down. It's to make sure that they operate safely, both for their staff and for their customers. And we found that just about every single business wants to figure out how to do it safely. And that's what we've been providing. So call that number and we can help that business figure out what they need to do.
To follow up on that, I know that that early on, I talked to the Department of Health, who actually brought in the Department of Commerce around protocols for grocery stores, and it was a several weeks process to roll out protocols. How are we identifying businesses, and how are we working with businesses to identify best practices as we're looking at opening up these businesses? You know, what resources are we providing to them, and what kind of outreach are we doing to them identify protocols and then be compliant?
Yeah, there's a couple of ways that we do that. One is that information is pushed out, typically through the economic development, through those folks. They push out, we can provide, we do provide information. We push it out. Those businesses are free to call us if they have any questions or, you know, any thoughts about implementation. And then we also operate on a complaint-based system. So if somebody calls, as we were talking about, and says, you know, I'm seeing something that is not right, they're not doing X, Y, or Z, then we'll go out and we'll also observe, talk to them, and see what's missing and provide that support. So we have both those directions of how we operate.
And we had a question that came in about people who tested positive. If the only resource they have is to quarantine, or if we have additional resources around them so that they're, I'm not totally clear on this, but if there are additional resources other than a simple quarantine. I'm sorry, I just got a clarification. People who came in contact with, got it. Okay, so people who came in contact with, who know that they had contact with a positive community, are there resources other than self-quarantining, so that if they don't actually have an infection, they're not having to quarantine for 2 to 3 weeks, sort of on their own? Yeah,
for certain essential activities, using a face mask and being very diligent about hand washing, hygiene, and staying away from others is a possibility. It really depends on the level of exposure. So it's hard to give a blanket answer, but there is another option, but it's only for an essential activity. Otherwise, as hard as it is, that's really how each of us contributes to slowing the spread, is the quarantine.
I guess the big question is, if you are an essential worker and that you've had an exposure, but you're asymptomatic, is there a way to get a test for being asymptomatic other than simply self-quarantining?
Those folks can get tested.
Where would they go?
Those folks can get tested. The big challenge is that if it's negative, that doesn't really mean that you don't have it. It might just be early enough that you're not showing. So it's helpful to a degree. And we certainly work with those individuals who are identified as part of contact tracing to figure out the testing for them.
Oh, and I had one question that just came in, and this is a great one because we've gotten a lot of conflicting information on this. So turn to the expert. When you are outside running or walking or bicycling, do we need to wear masks? Are they really just for indoors? What's the latest word on that?
The general recommendation is to wear masks when you're outside, because you don't really know when you're going to encounter somebody. And then you start putting your mask on after you're in range of them. Doesn't really serve the purpose, right? We also recognize that when you're doing strenuous activity, it might be very hard to wear a mask, right? And so, those are decisions that you're going to have to make. How can you make sure that when you're taking those activities, you don't unintentionally come into contact with others, that you have maybe a bandana around your neck that you can easily pull up, something to be able to take an action, so that if you choose not to wear one while you're running, let's say, you can put it on quickly when you see somebody approaching. That's really what we're looking for, is how do you minimize your risk? So there isn't a perfect answer. We're asking you to try as hard as you can.
Well, and I want to take this moment for a public service announcement. You do not need to wear a mask while you're driving and should not wear a mask while you're driving. As you know, especially if you're alone in the car, because we had a serious car accident from somebody they think they may have lost consciousness because they had a mask on. So if you're alone in the car, you don't need to wear a mask. Does the fever related to COVID-19 jump to 100 plus, or does it move up gradually? In other words, if you have a temperature at like 99.5 for a day or two, should you be concerned? Should you call and ask to be tested? You know, what is the range? Yeah,
typically what we see is that the fever with COVID-19 is not subtle. And so if you're having that 99s, it doesn't hit the threshold, because a fever is essentially when your body temperature goes up pretty high. It's not that kind of low level elevated, it's not even elevated, but within the normal range. So if you're monitoring your temperature, it's really making sure that you reach that cutoff of 100.0.
And I just wanted to say, I saw your face. Is the recommendation changed for masked while driving?
You're asking me, right?
Mm-hmm.
The one thing, so you don't need to wear a mask while you're driving at all. The one thing we just want to make sure is that when you take it off or put it on, that you're keeping your hands away from the front of it. So if it's a challenge for you, you can certainly pull it down so that you're not handling it, so that you can breathe a little bit more easily.
Thank you. I wanted to get clarification from the expert, because I am only on health and government operations. I am not a health. So I want to be clear on that. Well, we are coming up upon the hour, and I did get a message from Director Jordan, and she is not able to make it on this call today. She's going to try and join us on a future call, so I will update our information. But I just wanted to thank you again, Dr. Kalyanaraman. I'm going to get this right. Kalyanaraman. Dr. Kalyanaraman. I want to thank you for your time and for your expertise. I want to thank Senator Van Hollen once again for being on this call. For everyone who tuned in either on the Zoom or on the Facebook Live, this is just the first in a series. We will be tackling the issue of the economic impact and unemployment next week. And on the 20th, we will be looking at education equity issues in the time of COVID-19. And we are also looking at potential other issues that we're going to tackle. So please feel free to contact our office if you have questions, or if there are issues that you would like to see us approach in a future virtual town hall. Thank you all again. I am Delegate Bagnall, and I look forward to seeing you next week.